Hi, my name is Michele Arnold, and I'm the Chief Medical Officer at Swedish Issaquah. Last we spoke was January, and we were in the post-holiday surge with COVID cases here at the Swedish Issaquah Hospital. I think in that announcement, I mentioned that we never hit 30 cases in the building, and we didn't. We still have yet to hit 30 cases in the building. I don't think we will. We did get into the high 20s in January, which was our highest census with the COVID incident to date. But this last week, we've been in the single digits. So definitely a big improvement. I don't think that this has a whole lot to do with vaccines yet. I think this has to do with the surge from holiday gatherings. People got together. We saw a lot of transmission in the wake of that, and that filled our hospitals and our ICUs. We had a few days where we had to turn patients away to other ICUs in our system to get through that period. But nonetheless, now we're back down to those single digits. And so we have room to move about a bit, and it gives our staff a little bit of a break. They're pretty exhausted and worn out. It's been a long year, and travel to get away really hasn't been possible. I mean, we've even had travel restrictions on employees in addition to what's been imposed by our government. So we're underwater but not drowning. How's that? So first of all, the vaccine is definitely the light at the end of the tunnel for us. And the majority of our Swedish caregivers and employees have now received both vaccinations, both doses. So we're really confident in the safety of that vaccine. I wouldn't say we're guinea pigs, but we're willing participants in getting back to normal. And we've been really impressed with the safety profile of those vaccines. And so rest assured, if your clinical people are touting the advocacy for vaccines, that's our way out, and it's our way to safety. The challenge around vaccines is we don't know whether it reduces transmission, but we do know with certainty that it reduces, if not eliminates, severity of illness and hospitalization and death related to COVID. So if we can take scary COVID that kills people and turn it into nuisance COVID that causes a head cold or a flu-like syndrome, that means we can start going to movies and restaurants and shopping and traveling again. So that is our hope. And as we roll out vaccine, it's going to be a little bit bumpy, as you all know, because you're all waiting at the starting gates for your phase to open so that you can join the ranks. We're still in phase 1B tier 2. I'll have to double check that. Our phasing allows us to continue to provide vaccines to frontline healthcare providers and healthcare workers, as well as those over the age of 65 in the state of Washington. And then the next rollouts will involve more and more individuals, including essential workers and those who have multiple medical comorbidities or multiple medical problems and are particularly vulnerable. So that will roll out, and we'll await the governor's recommendations about when those will become available to the rest of our community. But we're not even through our age 65 and up. And the reason behind that is not that we're not out there ready to go, it's that the vaccine supply has been really tight and constrained. And I've seen many weeks go by where we put in orders and we only get 10% of what we ask for. And that's been a real challenge. We've stood up vaccine clinics only to not have much vaccine to give. And we know a lot of you are waiting on that vaccine, and we are ready to give it. We just need to have vaccine to give it to you. So the state is moving away from healthcare organizations for vaccination toward community organizations and mass vaccine clinics. So that's a little bit of a shift, meaning that you won't be coming into Swedish Issaquah for your vaccine. You're likely going to be going to a mass vaccination clinic. And several of them have been stood up around the community. None yet in Issaquah, but that's hopefully changing soon. We have one in Redmond, we have one in Auburn, which is a drive-through, really cool. And then a mass vaccine clinic at Seattle University downtown. And there's more to come on an even grander scale with the city of Seattle. But meanwhile, here on the East Side Fire and Rescue is looking to stand up our own mass vaccine clinic. And so Swedish will help partner, but Eastside Fire and Rescue is doing an outstanding job with getting that operationalized and working with the state to ensure that we have an appropriate location, likely going to be a drive-through opportunity. So really great news for the people in our community. And there are many other things that Eastside Fire and Rescue is working hard at to ensure that those who can't get to a drive-through can find their way. And they're working on a mobile clinic option. They actually go out into the community and touch areas where we may have marginalized communities and people who just can't get access. So we're really trying to shine lights into dark corners and make sure that those who are in need are getting their vaccine. So volunteer needs, that's a great topic. As we start to operationalize vaccine clinics, there will be a need to have some help. We don't have full-time folks that can dedicate themselves to vaccine clinics or to a drive-through opportunity. So the hope is that we'll be able to share with you a link and you could go in and sign up for an opportunity to serve. And there are a lot of different roles serving in a vaccine clinic, from helping people find their way around to directing traffic if you're qualified to do so, to just crowd control, answering questions, and for those who have clinical experience, actually being the person to put a vaccine in someone's arm or to observe someone after vaccination. So hang in there. We're working on a link that we can share in the next week or two that would give you some opportunities to be part of that vaccine volunteer rollout. So return to school is a hot topic, and there's fear and frustration and emotion that's driving a lot of frenzy, and I'm a parent and I've got kids in school too, and as a clinician I can speak to the safety of returning our kids to a learning environment where they continue to use appropriate masking and hand hygiene and physical social distancing, particularly around mealtime. And I have every assurance that our ISD officials are working very hard and working within the confines of safety to ensure that we get our students back to learning as soon as possible, but also in a safe fashion. So we've seen the success of return to school in other communities, and I'm sure that we can move forward with that. It's not going to look like a return to the school setting that we had a year ago or a year and a half ago. It's going to look different for a little while, but the hope is that's just going to be a little while. And I think that timeline is still up in the air. Many of us are hoping that we can get kids back in before the end of the school year, and some are already back in kind of a hybrid model, and the school district is working very hard to make sure that they roll that out safely and securely to keep staff and educators healthy. So hang in there. We're all going to get through this, and trust that they are working with best intentions. So Swedish goes through a process every 3 years to measure the healthcare needs of our communities. And we are due for our healthcare community needs assessment this calendar year. So 2021 is our 3-year renewal. And we basically assemble a work group to look into where we can serve the needs of our community best. We think we know, but we like to ask you because you can tell us. And in the past, Issaquah has identified as number 1, mental health, number 2, drug addiction, number 3, obesity, number 4, joint or back pain, number 5, diabetes, and number 6, homelessness. And so we're going to look at those same factors and see whether those continue to be high priority for our Issaquah and Eastside community. It looks a little different for our downtown communities, and they have their own health needs assessment that they go through at the downtown campus, and then also up in Edmonds and in Ballard. So we have our own niche that we can fit into to make sure that we meet our community need. We're hoping to have that process fully complete just before the end of the year. It'll take us a number of months to put that together and develop action plans as to how we partner with the community to address many of those needs. These days, it's not just about healthcare, it's about wellness, and it's about addressing what we call social determinants of health. And that's an area into which, you know, hospitals and nurses and physicians haven't always ventured. You know, we're not out there to solve homelessness, but we can help. We can help solve homelessness. And although we can't eliminate mental health, and it's going to take more than just the hospital system, we can contribute to that. And so this is an area where I feel, you know, healthcare and wellness leaves the building. And we can venture out into our community and help make an impact and deliver on those measures that are important to our community members. So hopefully I have more to share on that as the months roll by to let you know what you told us we should prioritize so that we can put our resources where they matter. I just want to say thank you so much to everyone in our community. We appreciate your support, and please know that we are standing by here to help support your health and your wellness. We are your ally. We're going to help get you through this COVID season, and you're going to help get us through this COVID season because we're stronger in this together. So thank you for your perseverance and your resilience. We can all use a little extra dose of that. And thank you for your patience and your willingness to journey through this with us. We really appreciate you.